One of the most common reasons someone ends up in a rheumatologist's office is pain. Pain can come in many different forms. It can be acute or chronic, and it can be localized or everywhere. What we're going to talk about today is how to talk about your pain to your doctor. I have heard literally thousands of patients describe their pain, and I have taught and trained young doctors. And I can tell you that how you communicate about your pain can influence the response you get from your doctor and ultimately get you answers and feeling better. The points I'll go over today is how I would tell a family member to talk about their pain when seeing a doctor to avoid being brushed aside or not believed. I'm Dr. Elizabeth Ortiz, and this is Connected Rheumatology. Let's get started. So I want to spend a minute talking about how we got here, why exactly we are running into problems when discussing and thus treating autoimmune-related pain. Let's start on the doctor's side. You see, a doctor's education and training is highly focused on looking for and understanding signs that we can see. These may be signs we see on a physical exam or signs we see on lab or imaging tests. We see it, we identify it, we come up with a plan. But what happens if we can't see it? Well, we immediately run into problems. Medicine is very much a, if you can't measure it, it can't improve it type of game. So enter the pain scale. The pain scale with the sad and happy faces is an attempt to measure pain so we can now improve it. Now, I'm not going to get into the history of the pain scale or its relationship to the opioid epidemic. It's a whole other can of worms, and I'm sure there are much smarter people out there who can speak to that. But what I can speak to is how it's not useful in my clinic where people suffer from chronic autoimmune-related pain. Despite its intentions to provide something we can see and measure, it has only provided us with a confusing data point that is difficult to interpret and then act on. So why is that? Well, because autoimmune-related pain is chronic pain that is poorly understood. We will often say it's related to inflammation, but is it? Or is it related to neurologic dysfunction? Or is it neurologic inflammation? See? Many more questions and answers. The hows and whys of chronic autoimmune-related pain are still being worked out, and so we don't have a reliable measurement device that will let us see the pain. So this means we, as patients, are left with our words to describe our pain. Words that have stumped poets for generations as they attempt to express the human experience and its relationship to pain. In the same way, expressing heartbreak, love, anxiety, and fear can be difficult for us, so is expressing how our pain feels. Pain is subjective, situational, and unique to each of us. So now that we understand the problem, how can we work with what we've got to get us the answers and relief that we're looking for? As I was saying, pain scales just aren't helpful, which is why you may find that even though you consistently say your pain is 9 or 10 out of 10, you aren't getting the response you would like from your healthcare provider. If you've watched my videos, you will know that I will always advocate for being as specific as possible when describing your symptoms. So instead of saying your hands hurt, tell me which fingers, when does it hurt, and is it associated with any swelling? But when dealing with autoimmune-related pain, it often doesn't feel very specific at all. So in situations like this, I recommend thinking about how your pain has required you to change up your routines, or how it has forced you to do things differently around the house or even give up certain activities. Some examples would be, do you now have to use a wheelchair? Have you stopped cooking because of your pain? Have you developed a whole pain management routine with creams and braces and medications? Describing your pain and how it affects your daily life in specific terms allows your doctor to better see your pain and then understand it. It sets the foundation for a plan to help you find relief and offers a baseline to which both of you can now use to compare your response to different interventions. Presenting your pain in this way, I believe, is a much more effective way of getting you and your doc on the same page so that you, 1, have conversations about realistic goals, and 2, discuss treatment plans to get to those goals. I know that even if you've never looked at the problem in this way, you are probably already aware of the doctors that don't see your pain. I have had many patients come to their appointments in substantial pain, having skipped their regular medication in an effort to show me how much pain they're in. I know this is often a response to being brushed off or dismissed in the past, but I would not recommend suffering through your appointment. Instead, think of examples in your life that demonstrate the severity of your pain. No one is comfortable or thinking clearly when in pain, and your doctor's appointments are definitely a time you want to be as clear-headed as possible. And one final note, this approach to describing your pain may lead to your doctor assuming that you have found a solution to your problem. Oh, they're good with the wheelchair, or they don't need to cook as much, or they like their current pain regimen. Make clear to them that your goal is to not continue with the accommodation you've had to make and that you are looking for other options. So, what are those other options? I want to spend a minute on the different responses you may get from your doctor when you have this conversation about your pain. I know we don't get much time in the clinic, and oftentimes tests are ordered, prescriptions are written, or referrals are made without much explanation. First off, you may get, and actually I hope you all get, an explanation. Based on your circumstances and the type of pain you're describing, you may be advised that your pain is not from your condition at all, but is due to something else. Common reasons for pain when you have an autoimmune condition, aside from the autoimmune condition itself, are tendinitis, bursitis, degenerative arthritis, neuropathy, or fibromyalgia. These issues may be related to your autoimmune condition, but may require a treatment plan that is separate from your autoimmune disease treatment. Secondly, you may be offered treatment or an intervention, something aimed at decreasing the pain that you've described. This can be the form in a new medication, a higher dose of the medication you're already on, or a procedure like an injection. This is oftentimes what many of us are wanting when we bring up our pain, and honestly, what most doctors want to provide, because after all, that is what is most in our wheelhouse. But it's important to keep in mind that very rarely are these treatments miracles. And it's always important to ask, what part of my pain or the symptoms I've described do you expect to improve with this intervention? And when will I see an effect? And this is where getting specific helps. So keeping with the examples, with this treatment, our goal is you only need the wheelchair when out for long periods of time, or you'll be able to cook on the weekends, or you can half the amount of pain medications you're taking. And of course, it's always good practice to ask what are the common side effects you should look out for and what to do if you find that you're experiencing them. Hand in hand with treatments, you may get a referral as a response to your pain. I like to always remind people that doctors aren't the end-all be-all, and although we can play a big part in your autoimmune journey, we aren't the experts in everything, and you really need a team approach to feel your best. You may be referred to any number of different specialists based on your circumstances, things like physical therapy, occupational therapy, pain management, or a neurologist. It can sometimes feel disappointing or perhaps like we are being brushed off when this happens, but I think it's actually really great. It shows me that the doctor understands their limitations and is eliciting the help of others. Based on the specialist expertise, you may gain even more clarity on the source of your pain and gain more tools to combat it. Tools that your doctor may not be able to give you. For those with chronic pain with or without an autoimmune condition, walking into a new doctor's office to discuss your pain can be a minefield. Will they believe me? Will they pay attention to me? We can walk in with our defenses up, which is only natural after being poo-pooed or brushed aside. I can't guarantee you won't have the experience again. What happens in the clinic room is a two-way relationship with two different people, and at the end of the day, we only have control over ourselves. But what I can attest to is that by describing your pain in terms of what you can and can't do, in tangible action words describing how you've had to change your life, this will put you in the best position to be understood so that you can move forward with next steps. Many times, people who've struggled with this along the way will be told that they have fibromyalgia. If this is you, I highly recommend checking out this video I did on fibromyalgia pain. I hope you found this useful. Please share and subscribe. It really helps get this in front of more eyeballs so more people can start having more productive conversations about their pain. Thanks, and we'll see you next time.